So good afternoon, everyone. Thank you very much for joining our One Nucleus by Wednesday webinar this afternoon. It's great to have you all. Hope everyone's well. So my name is Alicia Gallier. I'm in the business development team at One Nucleus. I hope everyone can hear me okay. Don't hesitate to interrupt if you can't, or to drop a message into the chat box, and I will take a look at my audio. Just one more person. Thank you. So One Nucleus has been continuing its Bio Wednesdays in a virtual format for a few months now. And it's great to have engaged with our network this way. It's been really successful. It's also really good to see the diversity of attendees, so obviously with no physical constraints. And our speaker today is a good example of that, as Ian isn't actually based in the UK. So today's session is also intended to be an interactive one, and Ian will explain a bit more about that. So bear with us. From past experience, it's usually been a really good way to run these formats as well, as it gives the audience a good chance to interact and share their thoughts and experiences as well. So it's kind of a learning experience for all. So as I mentioned, the format is going to be a presentation to begin with. So our speaker is Ian Yates, who is Director of Marketing and Business Development in the Laboratory Automation team at Thermo Fisher Scientific. So just a bit about Ian. So you've got you've worked for numerous life science organizations and across many countries. So previous positions were at GSK, AstraZeneca, and Velocity 11. So just to say thank you very much, Ian, for your support with the presentation today. And then a bit about the logistics. So I mentioned there'll be an interactive element, and Ian will touch upon that in his presentation. But aside from that, please feel free to use the chat box for your questions and your comments. And then following the presentation, the plan is to have an open Q&A session. So I invite attendees to unmute if they'd like to contribute then. So one last thing to mention is we are recording the session. So without further ado, Ian, over to you. Thanks.
Hey, thanks, Alicia. Can everybody hear me okay? If you could stick a thumbs up or nod. Alicia, can you hear okay?
All good.
Great, thank you. So I'd like to thank One Nucleus for this opportunity to chat to you today, as well as SLAS. I see we have Vicky Louise on the call, the CEO of SLAS, who kind of brokered this opportunity. And it's a great opportunity and one that's very relevant, I think, talking about automation now in the middle of a pandemic. Can you see my screen okay? If someone could nod.
Yes, okay. Thanks, Ian.
So what I'm going to talk about today, and again, it's an interactive session, so I'm expecting some work from the audience, is give you a little bit of an introduction about the lab automation team at Thermo Fisher Scientific, kind of at a very high level. And then we're going to look a little bit about how automation can already help today. So working in a pandemic or working in labs. And then we're going to move on to look at how can we maximize that impact in the future. So before we start, a technology check. So I want to make this an interactive session. So we're using a tool called Menti or Mentimeter. So if everybody could not leave the meeting, but either in a separate browser window on their computers or via their smartphones, if you could go to www.menti.com and enter the code 704755, you will be able to ask questions, give feedback, and participate. And just to confirm the technology is working, I have a question. Who will win the FA Cup final this weekend? International audience is quick to respond here.
I don't even know who's playing. It's not Barnsley.
No, but good escape by Barnsley there.
Ian, just
Yes,
to
it was.
interrupt, would it be possible to drop the code into the chat box, just in case some people didn't catch it? Thank you.
Yeah, do you want to do that?
I missed it when it flashed up. So.
70 47 55.
Thank you.
Okay, so it looks like we have some people that aren't sure what the FA Cup is. There must be our international audience, 4 Chelseas and 3 Arsenals, so pretty even. But great to see the technology is working, and we have 30. Oh, there we go, another one for Chelsea. 13 people, 14 people, 15 people logged in. So we're looking good, and we'll see if this prediction holds true on Sunday. So just a little bit about Thermo Fisher Scientific. And can people see this Zoom stuff? Or can you see I'm having lots of Zoom pop-ups.
I can see your screen still. Yep.
I'm just trying to get rid of how I minimize. Oh, hide floating meeting controls. There we go. So Thermo Fisher, obviously a big company. We're now, I think, up to 75,000 employees, 5,000 scientists, engineers working in R&D, over $1 billion invested in R&D each year, and revenues around the $24–25 billion mark. We have a mission we're proud of, and that's enabling our customers to make the world healthier, cleaner, and safer. And we do this via our 5, what we call premier brands. So Thermo Scientific, that's the brand that the lab automation team falls under. Applied Biosystems, our genetic analysis brand. Invitrogen, so all around discovery research. That's where you'll find our cell products. Fisher Scientific, our scientific channel for purchasing and kind of one-stop shop. And then Unity Lab Services. But I'm here today representing laboratory automation. So laboratory automation is a business unit within Thermo Fisher Scientific, and our tagline is called Automating Success. So another Mentimeter question. How much experience do you have with lab automation?
So just for those who have admitted, part of the session is using Mentimeter, an interactive tool, to do some audience participation. So to take part, you need to go to www.menti.com. I've dropped it into the chat. And then you can use the bespoke code, which is also in the chat, 704755, to take part. You just need to remember not to leave the meeting, just minimize the browser and use a different window. Thanks.
Great, so thanks everyone. So it looks like we have kind of a nice spread here. We have some people with no experience of lab automation, lots of people with some exposure, some quite experienced, some an extensive amount, but no gurus on the phone. My boss is on the call, and I'm surprised he hasn't claimed to be a lab automation guru, because he definitely is. So some nice humility here. So the business unit, the lab automation business unit at Thermo Fisher Scientific, I mean, what we really pride ourselves on is 3 things. We have a long history. So we are a combination business that makes both laboratory incubation products, automated incubation products, as well as life science robotics. And we've been doing that for over 20 years. So we've been kind of there from the beginning of the laboratory automation revolution, and we're very proud of our long history. Being part of a large company also means we have a global reach. So we have a total of 5,000 installations worldwide of our Cytomat incubators, automated incubators, as well as our integrated systems. And we were actually, the automation part of the business was acquired by Thermo Fisher. So we're based in Canada. A company called CRS Robotics was acquired by Thermo in 2002. And now why? So why does lab automation exist? What do we do for our customers? And basically we provide laboratory automation and incubation solutions, which enable our customers to deliver the results they need. And I think what's important here is the results they need may vary. And so that's why we say we're automating success. And success can be different from one lab to another. And so my next Menti question is, what does automating success mean to you? And apologies for these initial words. This was me testing last night and I forgot to delete the data. So if you could enter words of what automating success would mean to you if you're looking at automating a lab. So we have productivity, data, integration, more productivity, ease of use, reliable, robust, repeatable, efficiency, showing up well there. High throughput, that's one we hear quite often. AI just popped up. That's great, thanks everyone. So yeah, productivity is interesting. That's definitely is the number one here. Efficiency, ease of use, some great ideas. And this is kind of how we summarize it. So this is a slide from our standard kind of customer facing deck, and maximizing throughput is definitely an advantage of automation. So increasing uptime, increasing runs, maximizing throughput is kind of where automation started in the high throughput screening compound management world. I saw reproducibility pop up and repeatability pop up. That's another key advantage of automation. So improving both the processing uniformity to get you those repeatable and reproducible results. Reducing errors is another key one. So decreasing manual processes and opportunities for human error. One I didn't necessarily see come up is this flexibility to scale. What's possible on the lab bench with one individual or one technician can be very hard to scale up when throughput needs increase dramatically. That's something we are seeing play out in real time now is in the response to the COVID pandemic with testing. It's not as simple as just multiplying your technicians and your benchtop instruments. Decreasing FTE hands-on time. This is one that's very popular with the scientists who don't want to be loading an instrument every 45 minutes or every 30 minutes. They want to be able to have their instrument do the work while they're in their office or in the lab doing more value-added work. And then one I added to this slide for this presentation is business continuity. So a new request for lab automation that I don't think people had really been thinking about before is, how does automation help us allow research to continue during a pandemic? So now I'm going to move on to a few examples of how you can approach automation today. So what kind of tools exist there on the market? I'm obviously using our products to represent this, but there's various automation providers out there that offer similar, not quite as good options for doing automation. So what I'm going to do is take you through these 4 journeys and then give you kind of an example of the type of ROI that people are already seeing today. So the first journey is an instrument loading journey. This fits really nicely into those benefits around FTE walk-away time. Because basically you have an instrument. Here I have a qPCR device, and this typically runs for 45 minutes. So it's one of the most annoying devices in the lab for a scientist, because it's just long enough that they will leave it and go and try something else, but just short enough that they're going to get an annoying reminder on their phone every 45 minutes that it's time to add another plate. So really what customers are looking for here is manual loading, automating manual loading and increasing walk-away time. These are a mainstay of our product portfolio. We offer Orbiter robot with various devices. These are just some examples: flow cytometry, cell imaging, qPCR, plate reading, liquid handling dispensing. All are available as pre-configured automation bundles. And these are very simple solutions, but can have a dramatic impact on your efficiency and your walk-away time. So we did some work looking at various of our instruments coupled to a simple robot with stacks. And you could see that if we tried to run this process manually using kind of a standard business day and a person going and loading this device, it would take 6.2 business days for this Quant Studio to get through, how many plates? 40 plates. If we just put a simple robot on here, then we can cut that down to 1.7 business days. Because we can load the robot up in the morning, it runs all day. We can load it up in the evening and it will run all night. So some great kind of very quick wins from a small automation investment. Obviously, it also helps with social distancing as well, because the person doesn't need to be going in and out of the lab all of the time. The robot will be doing that. They go into the lab maybe once, twice, 3 times a day. We did the similar thing looking at the flow cytometry. The savings aren't quite as dramatic, but you can go from 3 business days of loading it manually to kind of an overnight run or an overday run with a small robotic integration. So that's an example of ROI looking at walkaway time. I'm interested if people have measured the ROI of any automation they have in their labs, and how have they done that? And this should be a free text field. Has anybody measured the ROI of automation in their labs? So this is actually not surprising. So there's lots of no's. There's some experience, resulting TAT, back of an envelope, no, but I'd hear more on this. This is not surprising, and it's something we see quite common in the industry, is people will buy automation, but then not really understand what benefits it has. So this is something that I would definitely advise anybody looking at automation to really focus on, is have a hypothesis ahead of time, do some calculations, and then see what it actually delivers, because that will really inform any future automation investments you make. So the next journey is what we call a simple workflow journey. So these are customers who are looking to involve kind of a handful of instruments in a workflow and a bit more complexity. So the example here is a liquid handler, an extraction device, a dispenser. You could have a reader on here or a qPCR machine. So again, here you're still looking for the walkaway time, but you're starting to add things like efficiency, consistency, removing human error, and getting those repeatable results. Here's an ROI that's interesting. So this ROI is actually based on cash savings. So a customer did an analysis of their manual workflow. They found gaps in some of those things we've already talked about, like how much capacity are they using, what's the data quality, consistency, traceability, and cost per sample. And so they brought in a very simple ELISA-based workstation. In their words, it has improved the integrity of our workflow by imparting better traceability, consistency, and reproducibility of results. And by their calculations, they were saving just over $120,000 US a year in labor and material costs. And they, at the same time, increased their capacity by 39%. So a great example of how it's not only time savings, it's also potentially money savings from these kind of simple workflow solutions. And then the other example I have of a simple workflow is a very relevant one. So it's from the Mediterranean Virology Institute. And here, this is put together a system for doing SARS-CoV-2 clinical screening. So the picture is very bad because it's a class 3 facility. And so it's taken from outside in the street. But here we have a cell imager. We have, again, an orbiter robot, and we have a cytomat incubator on this system. And what this system is looking for is COVID, so the COVID virus in cells. And what you see on this screen is this is kind of the day 1 picture and the day 6 picture. So they can see the impact of the growth of the COVID-2. So it's a clinical application for detecting the virus quite quickly. And sorry, this didn't copy and paste very well. But what's really interesting about this paper is they specifically call out some of the advantages of bringing in automation. in particular the social distancing one. So the second part of this highlighted paragraph, the main advantage of this technique in the automation, as it allows limiting the risk of exposure or contamination of the personnel, since plate monitoring and data analysis could be carried out from distance, thus avoiding direct contact and manual observations of co-cultures. So again, this is instead of calling out advantages of automation around throughput, here they are definitely seeing the big advantage of automation is separation from those clinical samples, as well as social distancing. So speaking of social distancing, how is your lab or office or facility applying social or physical distancing today? Another free text. Work from home. Masks. Strictly extended hours, it's common one shifts. Work from home, office based. Some booking of equipment, that's an interesting one. Limiting lab occupancy, working from home, working in teams, reducing staff numbers, reduced capacity. That's a common story we're hearing as well. So again, I think this is something not just in the UK, around the world, we're seeing that productivity is still being impacted by applying some of these social physical distancing rules. So the next journey, so this is where we're getting into kind of full workflow automation. So customers are looking for a solution to automate a complete workflow that provides kind of that real long work away time and kind of full confidence in experiment reproducibility. So this is the kind of approach where you may want to duplicate your configurable platform and set up multiples, and then you know that your samples are being treated the same, no matter which lab they're being tested in which kind of setting. And it also enables you to run multiple experiments in parallel. The example I'm giving here of a configurable platform is actually something that we announced, the pre-launch, launching soon, is Amplitude system. Solution.
Ian, your sound is gone a bit. Sorry, just to let you know. Oh, you're back. You're back. Oh.
Okay.
Yep. Thank you. Thanks.
Thanks. So this is something that we reacted to the pandemic, and we were able to fairly quickly configure a kind of end-to-end solution for the COVID-19 screening, allowing over 6,000 samples to be run in 24 hours. And kind of the two benefits of this, so it's a high throughput benefit, obviously the reproducibility benefit, and then something in particular is the 4-employee operation of the system. So one thing we've heard from customers, especially around COVID, is with the manual methods, there is lots of issues with scaling these. This is where the scaling really becomes an issue, because they're struggling to find the staff who want to load all of these instruments manually. They start to struggle with human errors. People get very tired and lose concentration and focus if you're spending even your 2-hour shift, let alone an 8-hour shift, loading plates into a device or moving plates between devices. So this has really highlighted how a configurable solution, and by thinking of automation first and having plug and play components, can really quickly deliver answers to some of the workflow challenges we're facing. So this is something that I think as a company we're very proud of being able to react quickly, and it really demonstrates the benefit of that configurable automation. So another lockdown pandemic question. Approximately what capacity is your lab currently operating at during the pandemic? give it a minute for any more answers. Definitely a clear pattern around the 51 to 75%. Interestingly, one lab operating at greater than 100%, and that's not surprising too. We're seeing specific labs that are really kind of, especially those involved in the screening efforts or the research efforts around COVID. But we are also still seeing generally a lot of labs operating at, again, here around 50 to 75% as they implement shifts and reduce working hours and having to book equipment and sterilize equipment between uses, all those kind of things. Okay, so the final automation journey I'm going to talk about is what we call our large system journey. So these are people that are really looking to automate pretty much an entire lab or a complex multi-step process. This is a little bit where automation started in the high throughput screening world, compound management world, where people were really looking at large scale automation to automate complete workflows. And these are more of your, some would say kind of custom solutions where there's a lot of work up front to define kind of the success criteria. But when they deliver, they offer kind of unparalleled performance in terms of throughput, reproducibility, robustness, all those kind of things. The example, I'm now going to try and show a video. Give me 1 second to see if this works. I find sharing videos over Zoom calls is hit and miss. So this is a system, can people see this? Yeah. This is a system we put together for NGS screening. So it has 3 modules, an extraction module, a library construction module, and a library quality control module, all linked together with what we call fast tracks, so automated conveyors. A total of 66 devices, all integrated, in this case with a F7 industrial robot. And this is a system that's truly very close to 24/7, 7 days a week operation. And you can see here, no human interaction, no cross-contamination. So, and as you can see, this is a true kind of one of our large systems, multiple robots working together on the same system, and all. What's really impressive here is really kind of the LIMS data integration. So the hardware is impressive, but the software integration is just as impressive and just as important. So that's just to give you a feel of what oh, shit.
Ian, would you like me to share the slide deck? Because I have it as well.
Oh, I'm just coming back. I lost my.
Okay, no problem.
I can't see my Zoom meeting anymore. So did you see the video?
Yes, yep, we could see that. Yep, it's on the screen again. Yep, there we go. Yep.
Good, sorry about that. Okay, so now we've gone through the 4 kind of lab automation journeys. I'd be interested in how people think which of these 4 journeys would be most relevant to their lab in their current situation. So instrument loading, just getting walkaway time from instruments. Simple workflow, putting together 3 or 4 instruments to do a kind of a simple task. A configurable platform, automating maybe 1 complete workflow, or a large system integration. We have 6 responses, fairly evenly distributed between kind of the 3 initial journeys: instrument loading, simple workflows, configurable platforms. Interesting. I'm happy no one chose I'd rather not use any automation. So, as we've talked about, automation can already deliver a lot of benefits, covering the kind of the entire workspace, from simple benchtop instrumentations all the way up to large kind of room size installations, covering a wide range of science as well. So the question is, if we want to get to a fully automated lab, what stands between where you are today and reaching that goal? And also feel free to answer if you don't want to get to a fully automated lab. Cost. Cost. Logistics. Only need low-level automation. Long-term utility, flexibility between workflows, that's a good one. Thank you. These are how I see the barriers to fully automated science. And I've split these into 4 categories. So I think 1 is really the physical interaction. All automation today is currently designed to be run by people. We need to supply them with reagents, we need to supply them with consumables, we need to supply them with samples for them to be able to run. Just as important as the physical interaction is the digital interaction. So we need to find a way to schedule the system availability. We need to find a way to initiate work. And we need to find a way, as was talked about in the Virology Institute example, to access results and interpret them, again, from a distance without having to go to the system. Monitoring and error handling is key as well. Getting status updates on the system, being able to handle when errors happen. And then lastly, service and support, being able to plan downtime as opposed to having unplanned downtime. And then these are just some ideas I have for those of you that are thinking of moving down this path towards a more automated lab. And I think it's important to realize that there's various steps on this journey as well. There's very large gains to be had. Looking just at some of those simple automation approaches we took, where you can just remove the number of people in the lab and remove the kind of lab population and have those people work more flexibly. And so I've kind of tried to arrange these from left to right in terms of level of complexity. So for example, with reagents, things to consider are ready-to-run packaging. One major frustration for running automation can be packaging is still supplied, assuming you're running lab experiments on the bench with maybe packs of 10 plates or reagent kits for 1 plate or 5 plates. In automation, you should definitely consider looking at ready-to-run packaging, where the packaging is run is the consumables and reagents are provided in a format that you can just load them up on the system. Another thing to consider is centralized reagent preparation. again, removing some of that in-lab time. And there are some solutions out there for automated reagent prep. These are still very much in their infancy, but is something that you could imagine on the horizon. Mobile robotics could play a role in all of these as you look to sort of replenish things on systems. And then kind of the ultimate goal would be to have integrated reagent supply, which is everything is fully integrated. With consumables, very similar to the reagents, with this concept of an integrated supply chain, where the device itself is telling a supply chain that it needs more microtiter plates or it needs more tips, and those are provided automatically. And then samples. I mean, one of the quickest win you can do with samples, again, very relevant from COVID testing, is try and standardize on a format. By standardizing on a format, you increase both your reproducibility and get rid of some of that complexity that we talked about. You can look at integrating storage with the automation, so that again, the automation itself is requesting the samples instead of a human having to bring them. And again, mobile robotics can play a role here. In terms of digital interaction, we saw the comment earlier about needing to schedule access to instruments. Obviously, the easy way is to do that with offline tools. So not connected to the system, use Outlook or Excel, schedule. Then it's moving those onto the system to have integrated tools so you can see real-time availability of the system. And then ultimately it's moving to smart planning, so a system that can deal with things like prioritization and resource loading and resource balancing. In terms of initiating work, currently that's often done at the system because it's tied to the physical loading of reagents and consumables. A first initial step is to make that remote enabled. And then the next logical step is to make that scientist friendly so that your scientists that are requesting the work don't need to understand the automation software. They will be able to request work in a language that works for them. Then we can look at auto scheduling work based on a large queue, and the automation itself schedules the work in the most efficient manner and link to the reagents, availability and sample availability. And then again, ultimate goal here is having that initiating work not tied to the physical setup. So you can separate those two things. Data analysis today, LIMS integrations are quite common, outputting the data, so we get that remote data access. Also two-way integration, so again, the work is triggered by a LIMS system or by an external system as opposed to on the automation itself. We're starting to see examples of automated interpretation of results. Again, this is something that we offer on our COVID platform, which is the results are generated and there's a built-in interpretive software or a link to an interpretive software that produces the results. Also, initial AI ML connectivity is out there where those results can be used, fed into a machine learning algorithm, and the instrumentation told what to do next. And ultimately, the goal here is really this closed loop science, where you have labs that are performing experiments, optimizing pathways, things like that, and the machine learning is directing that science. And then the last two barriers, monitoring, error handling, again, some quick wins here with installing cameras, remote access software, so you can view the system remotely. We're seeing a lot of this nowadays. Viewing is step number one. Step number two is remote control. That's both of the software, but also of the hardware, so you can potentially fix errors remotely. Automated error recovery is a good long-term goal, so the instrument can learn and recover from errors itself, and then increased robustness is really where I want to go to with lab automation. I saw that come up as one of the kind of the desires, and I think that's where the kind of the end goal is. And then service and support, again, we've seen a huge growth in the request for remote support tools for customers during this restriction. And we're starting to see instruments with Internet of Things enabled diagnostics, so instruments that will predict or be able to report their current status, and then that's what leads into this predictive maintenance. So instead of instruments failing and having to be repaired, the logic inside the instrument will say, I have used this pipette valve 4,000 times, it's now time for a change. Or I can sense that the CVs are deviating, now it's time for maintenance. Again, and the ultimate goal here is to get as close as possible to this maintenance-free design. So products and tools that any downtime is planned for regular maintenance, as opposed to unplanned, which impacts the ongoing science. So, 3 key takeaways. Lab automation has a demonstrated track record of increasing productivity in many labs. Hopefully, I think I've shown that today. It's now also taken on a more strategic role as part of a business continuity strategy. And when a pandemic arrives, it is too late to consider an automated approach. So I would definitely advise people to think about automation, and that's not just automating processes, but also think about how you would move to automated processes in the future, because we're seeing that we're now having lots of requests in a very short time. So it's good to think automation first. And now, questions.
Thanks, Ian. That was brilliant. Thank you so much. And thanks for trying out the Mentimeter. We're often at the mercy of technology on these these webinars, so I think that worked really well. So I just want to sort of open up to more audience input now, so sort of an open Q&A session. So please feel free if you have any questions or thoughts, or if there's anything you want to return to, in particular on Ian's presentation, you know, we can go back over that. I'll share my screen back up 1 second. But I thought I would kick things off, just to give people some time to think. And so one of the questions I thought I would pose is, how do we take automation to the next step in our laboratory spaces? And I'm aware we have a variety of companies, organizations on the call. And I know we have MBBJ, who are a recent new member for One Nucleus. We have some representatives on the call. So I just wondered if anyone from NBBJ maybe wanted to share a bit more on the physical considerations, building considerations when you're thinking of implementing an automated solution.
It's Mark Bryan here from MBBJ. Thank you for that little intro. I guess from a laboratory, if you like, environment perspective, one of the issues, and I'm thinking it would probably only involve some of the larger systems you have, with what additional services or cooling and so forth you'd require, or at what stage in automation would you start to look at requiring any building adjustment requirements to allow for you to take the equipment on board?
And I guess, is it a consideration as well in terms of the space you have, whether it's a new space or obviously an existing space? You need to think about how you're going to remodel or repurpose it. Is it I guess, is it easier to start with a completely new space than repurpose an existing?
It is, as providing you have it, I guess, from early stage. That knowledge, or indeed if you were to, as during the process of designing either refurb or a new laboratory, if you understand that a certain area within the building will be set aside for major automation, that obviously helps. But I'm sorry, Ian, I probably interrupted you there.
Oh, that's fine.
It's John here from MBBJ as well. I was just to add to what you said, Mark. We were looking at creating some new spaces for some automation for GSK recently. One of the issues that we had was that I think it would almost took longer. We couldn't get the room designed because the piece of automation hadn't been designed, and it was sort of a chicken and egg. and we couldn't design the room and get that built until we knew whether or not it was capable of accommodating the piece of equipment. So the trying to get the balance between when you can start designing your new piece of kit and when you can just start to design the room was a huge problem, because the programs for doing them weren't in sync.
Yeah, and I think my generic advice would be, like, involve the building people as early as possible and build for flexibility. I think for automation, there's obviously some common sense things, like your doors need to be larger, you need to be probably able to deal with a higher heat load, your floors need to be able to cope with the weight, things like that. But we've found working in, sometimes there is horror stories out there in the industry of people buying a system and then realizing it doesn't actually fit in the building. They can't get it in the door, so it's really working together is the key thing.
We also have Illumina on joining us on the call, and had a catch up with Stephen beforehand. Did you have any thoughts you wanted to share for this question, Stephen?
Well, we sit within the NGS space, and at the moment we really are setting ourselves up with vendors as partnering with liquid handling systems as sort of a place on the bench, one box solution. Now, whether that provides, well, it certainly doesn't provide an end-to-end solution, but that modular approach seems to be working better for our customers, where they have that as something that they can place, they can see how the standard method works, and then we have to help them in partnership with the vendors to optimize on each case. And that leads us around to the problem that we have is that most customers have differing requirements. They might want to run the same library prep, but they might have longer term goals to move from one library prep to another. So we have that sort of essential need to be able to have equipment that is open enough to repurpose, but is bespoke enough to provide them with the base requirements without going too far down the line and trying to dictate to them exactly what they will be doing as sort of an out-of-the-box solution. So it's a very hard thing to find the correct level of support, well, not so level of support, but the level of initial solution that we can offer.
Thank you, Stephen. Anything to add there, Ian, at all?
No, I think that's good. That's true. I think starting, that comes back to that scalability question. Start with what works for you and think about scalability. What may you need to do in the future?
I've just realised I can't see the chat box when I'm sharing, so just bear with me. I'm going to stop sharing my screen 1 second. Sorry, thank you. Just seeing, did we have any additional, oops, don't want to do that. Okay, so we have a question around cost. So given cost is perceived as a barrier to companies going down this route, is there any feeling that governments anywhere will support companies in investing in automation as part of the recovery plans and increasing resilience? That was from Tony, and he's left now. So if anybody wanted to share thoughts on that question. So the cost barrier, that came up, didn't it? The cost barrier was a big one.
I mean, there's two aspects of this question. I mean, obviously there's a fairly significant influx of money that varies from country to country as governments respond to COVID. But I think what's fascinating is it comes back to that ROI as well, which is automation is often seen to have a very large cost barrier. And part of that may be because we're not doing a very good job of quantifying the ROI. I mean, you saw some of those statistics there. I mean, taking it from a 6-day to a 2-day process, or a 3-day to an 8-hour process. I mean, the savings there are significant, but I think as an industry, we don't always do a good job of kind of doing that total cost of ownership model. And we focus on the upfront cost of establishing a system and less on the overall. And COVID is really highlighting that if you had taken an automation first approach, right now you would be in a very strong position, both in terms of COVID screening, but also just in terms of your laboratories.
It's almost that competitive edge, isn't it? It's allowing for. And any other thoughts on reducing cost as a barrier from anyone in the audience? Feel free to unmute if you want and just contribute.
Well, certainly, I think from where I sit within Illumina, our problem in essence is that we don't currently offer these end-to-end solutions. So, and we rely on vendors for the bulk of our automation solutions. So I think a lot of customers would be much more comfortable with a reagent rental type solution whereby they can, there's no initial massive CapEx expenditure. We can't currently offer that. And it's something that I think, well, I know for a fact that we're not intending on offering that anytime soon. And it's something I would rather we were investigating more heavily. I think that's where on the Thermo Fisher side of the fence, you have much more complete portfolio that you can offer.
Yeah, there's definitely a lot of interest in that model. It's like we always say, it's the photocopier model. No one buys a photocopier or a printer nowadays. You just buy the paper and the ink and get the machine for free. So I think we will definitely see the industry going down that route more and more.
Do we have Dave Mead from Isagenica on the call? I couldn't see if you joined, because you said you would be able to, you might have some interesting examples of how you've brought back your staff and utilized automation, if you're there, Dave. Perhaps he didn't join. And anyone else on the call want to share any examples of how they have brought staff back and utilized automation to do that? Maybe no one's in that position. Or very much learning still. And I mean, another thought I had was around the human interaction part. So we've explained obviously the benefits of automation, but the human contact is also important. So do you think we should be concerned moving forward about a potential loss, or maybe that's not really a factor we should be considering or thinking about when we're talking about being more productive and efficient? It doesn't really come up there. I don't know if anyone has any thoughts on that.
I think scientists want to do the best science they can and using the right tools for the job. I think I think we see people embracing automation. I mean, sometimes the first place people go is, I'm going to lose my job and this is a threat, but we find that really doesn't happen in these labs that bring in automation. It's very much around increasing the depth of science they can do, because most scientists do not want to be at a lab bench loading a plate onto a qPCR machine. So I think that's less of a concern. But it is interesting how our thinking has shifted a little bit. From a long time, automation was designed to work well with people, and it still has to work well with people. But as we're moving into some of the AI machine learning space, the interface with automation may change from the physical to the digital, which will bring kind of a different layer to the relationship.
Any other thoughts on that question at all?
Yeah, maybe I'm adding something to it. Ian, have you seen recent initiatives to familiarize people earlier, the students that just leave university or so, with automation? Because I think most people experience automation only in the workforce. Any thoughts along that line?
Yeah, that's a good question, and it's I'm sure an example you can think of is actually the first master's program in what's called automating science, which is run by Carnegie Mellon University, and they actually give a cohort of students who are going through a program that's about doing science in an automated way. Because that's a great point. Often people do science in universities using hand pipettes and kind of very basic equipment, and then they move into the industry, and it's a completely different. So I think we will see a lot more education on both the machine learning side as well as the physical automation side.
definitely something that people are interested in, and I hate to say the younger generation. I'm meeting with our next cohort of interns tomorrow to give them an overview of what projects we have for them this year, and yeah, they're definitely showing a huge amount of increase in that over than doing yet more pipetting work on a bench.
Yeah.
So I guess another point I was going to bring up is, should we have been doing this sooner? But I think, Ian, you answered that in your presentation. I wonder, from those who are already sort of heavily involved with it, is there any sense of frustration that some parts of the life sciences are behind in automation? Or is that not correct? I might be wrong there.
I mean, my perspective on this is twofold. I think there's frustration. I mean, we see frustration. I just read an interesting New York Times article about frustration that people can't buy pipette tips to do COVID screening. So I think there was kind of a frustration of kind of getting automation to work now. I think it also interesting, it comes back to the cost and robustness discussions we had earlier, because we're in a bit of a vicious cycle with automation. Is people think it costs too much. It's not as widely adopted as it could be, which means it still can be quite expensive. So we're in a bit of a vicious cycle of it costs too much, so we're not going to do it. So I think this is really highlighting the need to move it from kind of a tactical choice to automate to more of a strategic choice, because I think it will give you long-term competitive advantages for the companies that do it well.
We are close to time, but there is one more question come through. So, in labs with suboptimal amounts of funding, how does one plan ahead for CapEx sustainability, especially since technology to do the same kind of assays experiments are evolving constantly, i.e. over customizing the automated workflow runs the risk of becoming obsolete?
I agree, and I think that's why it was interesting when we asked the question, which of these platforms appeal to you? There was a lot of interest in the kind of the more flexible workstation and configurable platform approaches. And I think I see a future where the large systems are reserved for specific applications where you're confident that this is going to be a workflow that's going to be around for a while and is not going to change. And also, even with those large systems, you build in configurability and flexibility. It's more just a scale question. So that's why we're definitely pushing a strategy of what we call configurable automation, where it really is plug and play. So a new reader technology comes along, or a new sequencing device from Illumina, you switch it in. And I think that's really where the automation market's going.
For the interactive part, Ian, will we be able to share that with attendees, the word maps and responses?
Yeah.
Fab. I'm happy to send that out if you share it with me. So we're up to time now. So just wanted to say thank you for all joining, and thank you, Ian, for sharing your expertise, and for all those who contributed in the Q&A. It was, again, great to bring our network together, and we hope to continue the virtual format and then see how things go in terms of events going forward. So yeah, we appreciate the engagement, and I wish you a good rest of the day. So thank you all for joining. Take care.
Thank you. Thanks, everyone. Bye-bye.
Bye.
Thanks, Ian.
Ian.
Thank you.